The Alberta government has just released a report into the mental health and addictions problems in the province. The report details several recommendations to make the mental health and addictions treatment systems in Alberta better. The report lays out 6 major directives for the government to act on. Of those directives, 3 involve addictions and 2 involve children. The report focuses on access to treatment for Aboriginals and youth. Great. It should be much easier for us to find mental health treatment in our own communities. And given the spate of fentanyl deaths and overdoses across Alberta, I'm very pleased to see the government taking an interest in making an investment in addictions treatment. It saves lives. And that brings me to my next point, saving lives. When you really drill down on the report, it misses something vital. And it's something vital given the recent jump in suicides in the province. The report itself seems to include suicide as an afterthought. And given the 30% hike in the number of suicides in Alberta, it really should have been a focus and not just a bookend. And while the report refers over and over to the demographics we most often think of as the ones who face mental health challenges, Aboriginals and youth, it failed to mention the demographics that end their lives by their own hands most frequently. Middle-aged men kill themselves in remarkably higher instances than any other group. According to Stats Canada data, men kill themselves at 3 times the rate of women, and the highest rate of suicide is men aged 40 to 59. Just look at these graphs. These are middle-class, middle-aged men, our dads and grandpas, and they're killing themselves at a much higher rate than youth or women, consistently, year over year. How can any mental health initiative not make this staggering fact a centerpiece? And again, according to Stats Canada, contributing factors to suicide are loss and financial hardship. And we have a lot of that going around in Alberta. But really, is the government serious about mental health at all? Well, after this much-awaited report, the government has promised to commit just $4 million additionally to mental health in Alberta. Now that's in a province of over 4 million people. That's $1 a person when we are in the middle of a suicide crisis. That doesn't seem that serious to me. The NDP just dished out an additional $5 million in subsidies for green tech companies in January. And they added an additional $30 million in funding for green transit initiatives across the province. Seems to me the NDP have their priorities wrong. If the government wants to save lives, our dads and our grandfathers need to be a focus in any mental health strategy, not an afterthought. I know middle-aged, middle-class men aren't exactly the favorites of the social justice types in our government, but their lives matter. The government needs to care about middle-aged men as much as they do about windmills and electric buses. For the Rebel.media, I'm Sheila Gunn Reid.